Okay, so sometimes we get our femur not translating into our pelvis or this hip socket super well, and so this causes a ton of pain. Okay, so it can result in tons of anterior pain, or it can even result in you like tilting your pelvis to the point because you can't fully extend this hip. And so you can even just do a quick test of like, can I actually get into a fully extended position? Can I even do a couch stretch? Can I get in this deep lunge and push my hips down into this? If something's limited you from getting in this straight upright position, then let's work on this translation of the hip. It might not be necessarily tight soft tissues like ligaments and tendons. It could actually be from that hip socket not translating, not being in the right position, not moving around in that ball and socket joint the way that it should be. So there's a few different stretches we can do to help get this aligning in that pelvis better. So I've got a really heavy resistance band here. I got it as high in this hip socket as I can get it, so very top of the inner thigh. And now I'm gonna get moved to the side here where I can really get some good resistance pulling. This is just a banded distraction here. It's gonna allow me to get on all fours here, and I'm going to shift my weight onto this leg, okay? I don't want to shift it too far here, but I want it to be straight up and down. So my weight is going into that femur, right straight into that knee. And all I'm going to do here is I'm just going to sit back slightly to get it past 90 degrees, keeping that weight on that leg here. And what I can do to help work on that hip capsule is I can turn that leg in, keeping that weight going through the knee. And I can turn the leg out, working on that just for a couple minutes aside, okay? That's the first stretch. Again, test, retest, okay? So test, okay, how's that feel? Is that helping me move a little bit better? Is that getting any improvement? Okay, next is I can actually lay down on my back here, okay? So I'm getting this up towards the front of the hip now. So I got this here, and I'm gonna need to scoot back, get some serious tension on this thing. What this is doing is pulling this down, getting it into a better position where it can pull it into that socket. I can pull it across here as sort of a figure four position here. So by getting enough tension on that, it's getting a nice band of distraction. And now as I just pull this, I can keep this here and I can pull it. If I need to, I can pull it across a little bit. Don't go too far, otherwise it's gonna possibly impinge something there, okay? But this is just allowing that to pull into that socket. If you're feeling still a little bit of tension, let's add a little banded, another second banded distraction on here. What it's going to allow me to do is work on that posterior as well. Okay, so now I got this distraction working on that hip capsule, and now I'm just going to pump my leg a little bit. Okay, keeping this other leg down straight. It's active straight leg raise here. I'm just getting that pump, get 30 to 50 pumps here. And then just hold it at that in range and just kind of work around, angle it. And this is just working on that hip capsule, allow it to translate inside that pelvis better. Okay, and as you do this, make sure you're keeping your belly button down, okay? If I'm getting too hyperextended, I'm not allowing the pelvis to be in that good position, allowed to translate inside that hip capsule well. Okay? Just a couple minutes aside. Those are just a few different mobilizations with this band distraction that can help you get your hip translating in a much better position. That's going to allow you to sit deeper in that squat with a good position. It's going to allow you to be fully extended, get that hip translating. You can already tell here, this is allowing me to get fully extended here even better than what I just did on my right side. My right side is even tighter after I just worked on my left. So give that a try, see if it gets your hip working a little bit better.